I'm Dr. Della, and I treat every kind of dental damage you can possibly imagine, from tiny oops habits to full-blown how did this even happen situations. So today we're doing a dental habit tier list where we're ranking everyday things people do to their teeth, from totally harmless to this is how you end up with major dental work. This isn't a lecture, it's not super scientific, but yes, there is real science behind it, and it's all based on what I see every single day in the chair. And if you do any of these habits, and you probably do, you're going to want to stick around and see where they land. So let's get into it. Number one is brushing too hard. And you know people who brush with the brute force of scrubbing a dirty pan, and that's frankly a problem. And overbrushing can wear down the enamel, it can damage the gum lines, it can cause sensitivity, and studies show people who use these kind of hard bristle toothbrushes, or they press too much, they get these gum recessions much faster. So we're gonna put this in moderate risk. I'm putting this in the moderate danger tier. There are patients who literally brush their gums into retreat. That's called gum recession, and once that gum tissue is gone, it doesn't grow back. You're left with sensitivity, with exposed root surfaces, and a higher risk of decay. And studies actually show that aggressive brushing behavior is more likely to cause this. So if your toothbrush looks like it's been going through a hurricane within a month, take the hint. Gentle, circular motions. Think about a massage perhaps, and not really a scrub. Number two is skipping flossing at night, or frankly never flossing even. So plaque builds up overnight. So without flossing, there is risk of gum disease, so gingivitis, which turns into periodontitis, bad breath, and even systemic inflammation. It's common, and the long-term consequences are so serious. I think high is good for this, because even if you can't see the immediate damage, the harm accumulates, and flossing once a day, especially at night, is like dental hygiene's cheat code, and skipping it, huge mistake. Here's why. During the day, you eat, you snack, and build up plaque between your teeth, and the tight little spots your brush just can't reach. And if that plaque sits there overnight, it turns into tartar, into calculus, which is hardened bacteria, which leads to inflammation and boom, gum disease. And I really want to get into this, really want to emphasize this, that gum disease causes bone loss over time. So the bone that holds your teeth into place, you lose that bone, your tooth gets wobbly, you lose a tooth. And you don't usually feel pain until the damage is done, which is why it's so sneaky and it goes into high risk. Number three, eating sugary, acidic foods all day, every day. So regular soda, citrus, wine, or sour candies, they all attack the tooth enamel, they promote cavities, erosion, and people assume I'll be fine, I brush right after, but frequency really, really matters. If you sip soda all day, enamel doesn't get a chance to reharden, and I'd call this a very high danger. So sugar feeds the bacteria that cause cavities, and acid weakens your enamel, but here's the kicker. Frequency is more important than anything else. So sipping a soda slowly over 3 hours is actually way worse than drinking it quickly with a meal. Quick pause. If this list is already making you rethink a habit or two, hit subscribe. I post stuff like this all the time, so you can avoid these expensive mistakes before they happen. Alright, let's get back into the list. Alright, number 4, using teeth as tools, meaning opening bottles or tearing packages or biting your nails, chewing ice or bottle caps, or using your teeth as scissors. It might sound small, right? But risks are often actually quite serious. Sharp cracks, chips, even fractures. Probably moderate to high is where I want to put this, depending on how often I'm leaning towards high. If it's habitual, I call this the Swiss Army mouth, and it's a terrible idea. Your teeth aren't tools. They're meant for chewing, not as acting as scissors or bottle openers. Number 5, grinding or clenching. Night grinding especially wears down the enamel. It causes a lot of jaw pain. It causes these headaches. It can crack teeth, and in some, serious cases, you will need crowns. And sometimes people don't even know that they're doing it in the first place. And I put this as very high. And the reason for this is it's one of the most dangerous everyday habits that you will be doing every single night. Alright, number 6 is poor dental hygiene, aka regular checkups. So rinsing with water, or maybe brushing every few days, never letting a dentist see you until it frankly hurts. This can lead to decay, huge cavities, infections, and maybe things like abscesses, which can be quite dangerous. I will be putting this in the extreme risk. If prolonged, severe complications are possible with this, so I think it really does deserve the extreme list. Next is smoking and tobacco, vaping. We're going to put them all in the same category. And sure, vaping maybe kills more slowly, but they're all hugely dangerous. Gum disease can be caused by all three. Tooth staining, oral cancers, poor healing after surgical procedures, and this is going to 100% without a doubt have to go in the extreme category. Tobacco in all forms. It wreaks havoc on your mouth. It stains your teeth. It dries out your own mouth. It destroys gum tissue, slows healing, drastically raises your risk of oral cancer. And I know what you're thinking. Yes, vaping as well, even though it's marketed as safer, the research shows otherwise. It still causes the gum inflammation and increases the cavity risk due to these sugary flavorings and dry mouth. One of the saddest things I do as a dentist is catch these early signs of oral cancer, or these white lesions that seem harmless, but they're cancer. It doesn't always look scary. It sometimes looks very harmless. Just a small little white or red patch on your tongue. But it can spread fast, and it can frankly change lives forever. And if you're a smoker or vapor, there's no shame, okay? Just information. Talk to your dentist or doctor about quitting. But this will have to go in the extreme risk. Next one is chewing very hard or abrasive foods like hard nuts or popcorn kernels, and you get the idea. And occasionally these are fine, but a habitual eating of these hard foods is super risky for chips and fractures and sometimes microfractures. Probably going to have to put this in the low to moderate. I'll just put this in the low because it's less likely to be life-threatening, but it's also quite annoying and costly. We're going to put this in the low category. Next up is mouth piercing. So this can be lip piercings or tongue piercings, and these jewelries can cause risks of gum inflammation, gum recession, tooth damage as they hit your tooth, infections, choking on it if it becomes loose. And if care is bad, it can get pretty serious. And I've seen some pretty bad stuff, so I'll have to say moderate on this. And it's not even just the infections. These tongue piercings especially, they can hit the cheek, and even these lip piercings can hit the cheek and cause these little chip damage, chip teeth, and constant rubbing against the gums can really cause that recession, and over time it can actually be pretty bad, okay? So it's really not ideal, especially during sports. So if you have a piercing, it's not an automatic danger, but good hygiene and regular dental checkups are frankly non-negotiable. So there you go. There is your dental tier list. Habits that might seem harmless, might seem cool, might seem awesome, but could do some serious damage long term. So let me know what you think. Did I overshoot the danger for any of these? Do you disagree with any of these? Do you maybe have some of these? Or maybe did I miss some of these? Drop a comment, and as always, take care of your teeth, stay smiley, and stay healthy.